Good morning. So can you tell me what an MSN CNL is?
So MSN stands for Master of Science in Nursing. In nursing, we have several academic degrees. The Bachelor's of Nursing is considered the BSN, or the Bachelor of Science in Nursing. And then we also have the PhD and the DNP. The PhD is a Doctor of Philosophy in Nursing, and the DNP is a Doctor of Nursing Practice. Okay. And then the CNL part stands for Clinical Nurse Leader, and it's a certification that the nurses will be able to sit for a certification exam after they finish the 2-year full-time program.
Okay, can you tell me how this program came to be at an osteopathic medical school?
Well, LECOM already has many graduate programs, including we have a School of Healthcare Administration, we have a School of Graduate School of Biomedical Sciences, we've got the School of Public Health, those kind of things. So it is just a program that seems to fit into the graduate school. And so nursing does also have philosophy that's very similar to osteopathy, in the fact that we have our basic tenets are holistic care, health care prevention of disease, and also patient advocacy.
So can you tell me what an MSN CNL is?
So MSN stands for Master of Science in Nursing, and CNL stands for Clinical Nurse Leader. The Master of Science in Nursing is the academic degree. In nursing, we don't just call it an MS, or it's considered a Master's of Science in Nursing. So that's why the MSN. Similarly to when a nurse gets an associate's degree, it's not called an associate's degree; it's called Associate's Degree in Nursing, ADN. Okay. So, Masters of Science in Nursing is a graduate program, and nurses who have a bachelor's in nursing are eligible for a master's.
And how did it come to be part of a program at an osteopathic medical school?
So, LECOM already has lots of graduate programs, especially in the Graduate School of Biomedical Sciences. Also, we have lots of other healthcare schools within LECOM, including Healthcare Administration, School of Public Health, those kind of things. So it seemed to be just a very good fit for that, as well as osteopathic medicine has similar philosophy to approaching patient care, just like nursing does in terms of patient advocacy, healthcare promotion, and also a holistic view of approaching a patient in their care.
All right. So who would be eligible to apply for this program?
So nurses who do hold a bachelor's in nursing. Currently, we are doing the master's with a bachelor's degree prepared nurses only. We are going to hopefully develop an RN to BSN so that RNs can also be eligible without the bachelor's to go right to a master's. But folks right now need to hold a bachelor's degree in nursing by the time the classes start. And also they must have a 3.5 or higher GPA in their undergraduate, starting with our second cohort. And also starting with our second cohort, a GRE.
Equivalent?
Yeah.
Okay.
Yep,
so you're saying that right now the person that applies has to have a bachelor's degree?
Yes.
And an RN degree?
Yes.
Okay.
Yeah, they have to have an RN license. So,
a license.
So what RN stands for registered nurse. Most states consider it professional nurses to make it different from LPNs.
Okay.
And so with a registered nurse degree, if a registered nurse licensure, if a ADN grad sits for the boards for RN, then they would earn their RN successfully. And if they went to a 4-year program, they'd have a bachelor's.
Okay. So you're looking for candidates that have had their bachelor's, are currently working as RNs, and what advantage would this program have for them? Okay.
So the clinical nurse leader is a certification as an advanced practice nurse. So along with a graduate degree, a master's, they would also earn the education that they need to sit for national certification with the national board. And so that would definitely further their education, both in terms of academics and also in terms of their clinical leadership skills.
Okay.
And so that would be the main benefit for nurses. Also, lots of employers will increase their pay. They'll be eligible for definitely more promotion.
Okay, so this program would help an RN go into administrative parts of their job?
So it's a very good question. So basically, the nurses that will apply for this program are in leadership positions already. So they hold positions of leadership, but they don't have the certification.
Okay, so this would give them the certification to really
to be nationally certified.
Certified would give them an advantage over a person that might be in leadership that does not have this degree.
That's correct.
Okay.
Yep.
All right. So I understand that this program is entirely virtual, but that the program prepares nurses to sit for their national boards in that leadership position as a clinical nurse leader. So how does the student get their clinical hours?
Okay.
And who sets what they have to do?
Okay, very good. So the CNL requires for the nurse to have at least 500 clinical clock hours at a clinical placement with a preceptor. This program is different than others in that we allow our students to do their clinical hours at their place of employment. So many of the nurses are going to be working Monday through Friday, kind of 9 to 5 type things in leadership. And so this would allow them to continue to do that and work with the preceptor on the skills that they need to be working on for that particular practicum. So for instance, if a nurse is working on a certain policy and that's going to be their capstone, then they would be working on that with their preceptor or preceptors. The preceptors are chosen in terms of being in a leadership position, whether they have a master's degree, a clinical nurse leader, and also DOs are also fine to be preceptors.
So if a nurse is working in an office setting rather than a hospital setting, they could still, their physician that they work with could be their preceptor for this program. Is that true?
Yes, and we would prefer DOs because it's more of a philosophy that nursing has, as I explained before. But if they're learning leadership skills, so it's going to be definitely focused to more administration. But these students will still have an active role with patients as well. It just will enhance their leadership skills.
So in a practice setting, they may be desiring more training so that they can be now the office manager. And in a hospital setting, it would be so that they could maybe be the director of nursing or have some kind of administrative role. Is that correct?
That's correct.
Okay. All right, great. There are many big online universities offering virtual programs for nursing academic degrees and clinical specialties. What makes this program stand out as being attractive for an RN who maybe has a full-time job or is working nights or doing some kind of work that maybe doesn't make them a traditional student?
Right, right. I'm so glad you asked that question because there is a lot of competition out there, and nursing is absolutely no exception in terms of the online programs. The top programs offer similarly to what we offer, which is that the nurse will go through their coursework at their own pace. So it's very different than traditional when you have to take 4 classes and you have to take 4 classes in the classroom and your whole entire life is school. So this would not be the case with this program, definitely. Nurses can take the courses one at a time in 8-week terms if they're part-time, and they can also go through the summer and finish in 3 years. If they want to go full-time, they can take 2 classes at a time and do the same thing. So we're very flexible, and also tuition would not be as it is for a full-time taking 4 classes at a time. It would be 1 class at a time. So, and our tuition is very, very much reduced from those top programs that do not offer clinical placements in their place of employment, and they don't offer for the students to pay, $414 per credit hour. That's what we're charging for clinical affiliates. So it's much reduced. And then if you're working in a hospital that also offers tuition remission, you can get $3,000 to $5,000 each year for furthering your career.
So if someone has a full-time job, maybe is a mom that's home, they could still use this program to get their clinical leadership skills on their own time. So they could take one credit at a time, or they could take a full credit load at a time.
Exactly.
It works either way.
And depending on their situation at work, they might be able to do coursework at work as well.
Okay.
So it's as I'm director of the program, and I was a student for 16, 17 years, a long time. And I understand the competing interests that nurses have. We have families to raise. We have maybe older parents that we're taking care of. We have, we also have our own life and things like that. And then we have our work responsibilities. So for any nurse who is out of work at the time, then we would arrange for clinical placements for that person.
Okay. So they don't have to be affiliated with a clinical place at the moment.
That's correct.
You'll help provide that through your preceptor program.
Yes.
Okay, that's great. So is there, you just answered that question, is there any flexibility? Yes, there is. So when does this program start, and how long are you accepting applications?
Okay, so for this particular, our first cohort, we are accepting applications through July 1st, and possibly if we need a little bit more time on that, that's fine, because it's the first cohort. Classes start officially on the 31st of July, but as I said, nurses will take their coursework as it works for them independently. So the length of time that they take the course, whether they take 2, 3, or 4 together at the same time, that's all up to them.
So would they be able to start off schedule? You said classes start July 31st, but
Yes.
let's say someone has to complete a job that they want to do before they start. Could they start middle of August?
We at this point, part-timers are going to start either in July or in January.
Okay.
So if they're doing the part-time, if they're doing full-time, they need to start July 31st.
Okay.
We also do have an orientation that will be by Zoom. It will be recorded, but it's also going to be encouraged to be synchronous, so that the students are able to meet each other, because this is a virtual program. So this would be the only way that they would meet each other, and that they can meet the faculty as well of the courses,
Okay.
kind of face-to-face.
Great. Good. So how do nurses learn more about this program, and how can they apply?
Okay, so on this video, we're going to have the link so that you can go ahead and take a look at the program itself. We also have links within that link that will take you to the curriculum, and also to take you to the requirements for admission, and also directly link you to the application.
Okay. Great. Thank you so much.